Thanks very much, Paul. Morning, colleagues. Great to be here with you this morning, and thanks so much to JL Assessment for the invite to come along and talk a little bit this morning about Early Talk for York. So Early Talk for York's been up and running for coming up for 5 years now. And as you'll see, we talk about it as a local area approach to improving speech language communication outcomes 0 to 5. Paul used the word project lots of times in his introduction there, and we're really keen to avoid the term project when we talk about Early Talk for York, because projects have definite end dates, and we're keen to see Early Talk for York continue to be a way of working in York for the foreseeable future. So next 10 or 15 minutes, I'm going to give you a kind of whistle-stop tour through what's quite a complex piece of work. I'll definitely miss bits out, but happy to take questions when the time arises also. Thanks, Paul. If we can have the next slide, please. So just to set a bit of context around York, we're conscious of the preconceptions that people have about York as a relatively affluent, picturesque, and popular tourist destination. But what that hides is some relatively significant inequalities in the city, as this chart starts to demonstrate. So essentially the headlines are that, so this is good level development at the end of reception, so that's statutory assessment point, age 5. Headlines are children do incredibly well in York, unless they come from a disadvantaged background, in which case they historically have done particularly poorly. In 2017, we had the largest attainment gap of any local authority in the country. And the very kind of foundations and roots of Early Talk for York can be found in that kind of shock wake-up call, I guess, for York as to urgent action needed to address improving outcomes, particularly for those children who come from disadvantaged backgrounds. Next slide, please. So I'm sure for many of you on the call, I don't need to make these evidence-based arguments around why a focus on early language is a really sensible place to start. There's really good evidence from good UK and international studies that suggest that children's early language skills are hugely important and predictive of lots of whole of life outcomes through into mental health in teenage and adulthood, employment skills, literacy skills, etc. Such as the strength of evidence we saw back in 2017, the EIF calling for children's language development to be viewed as a public health wellbeing indicator rather than just an individual clinical concern. And the reason I kind of flagged this when talking about setup of the project is this was really important for making sure that we had kind of strategic buy-in to the concept of early talk from the broadest range of partners possible across health, care, communities, education, to really give it the kind of best possible chance of success right from the start. Thank you. Next slide, please. So this is where we kind of started out. Our headline plan essentially had 3 domains to it. Our kind of vaguest, I guess, at the start was around strategy and commissioning, but we knew that if we were working together in the kind of relatively complex, can we just go back one, Paul? Thanks. Kind of early years space, that if we're bringing people together to work more closely and better for children and their families, that there would be opportunities to improve the system as a whole. And I'll reference some examples of how that's happened over the last 5 years shortly. Big bit of work around workforce development. We know that having highly skilled, qualified, confident, knowledgeable practitioners to work with children and their families is a super important way of improving outcomes. And then finally, communications and community, knowing that the importance of the home environment in its broadest sense has on the impact of early childhood development, and making sure that we attended to that from the start also. And finally, to say, we started with a kind of proof of concept idea. So we started small over in the west of York, where we've got a kind of higher proportion of our disadvantaged cohort, with a kind of small, clustered around a small group of schools, but the feeder settings that feed into those schools, and partners in communities and health also working in that area. Thanks. Next slide, please. We've been keen to kind of maintain an evidence-informed approach to early talk for York from the outset. So as well as evaluating as effectively as we've been able to, attending to what does the evidence say about how best to go about improving outcomes in speech-language communication for young children, but also to work in a strengths-based manner. So obviously, as in all of your localities, lots of great work already going on in this space, and not wanting to be the kind of next new shiny thing that came along, was short-term, short-lived. I'm sure we've all got experience of that kind of thing happening. However, the headlines from the evidence, if we had to summarize them briefly, would say were these. So really paying attention to the issue of under-identification of need that we know exists right the way across our nation as a real problem. So using high-quality assessment to do that, and Welcome has played a significant part in that. Ensuring we've got expert staff who've got the knowledge, skills, and time to do those things that make the biggest difference with children, which often can be boiled down to essentially having really high-quality interactions with them as frequently as possible. Swift and appropriate intervention for those that need it, and again, Welcome on the Big Book of Ideas has been a really good starting point for that. And then finally, I think we've been also really kind of keen to attend to the evidence around how to implement a piece of work to improve outcomes. So yeah, the what is really important, but how we do that and what the evidence says around what high quality professional development looks like and how we sustain and support and embed all of that has also been an important factor. Thanks. Next slide, please. So there's lots of aspects of early talk for York, but these are the kind of headline ones that I'd summarise. So we use a couple of commercial products. Some of you will be familiar with Elkland, so we use them as our kind of core training package. We use it, so that was again a kind of strengths-based approach. It was something that was being used widely in the city before we started. However, where that was sitting was often with individuals. The communication-friendly setting status package takes it right the way through to ensuring that there's a quality-assured approach to cascading that training right the way across whole teams, and that consistency that we know is really important. Secondly, the use of Welcome. We started out offering Welcome as a tool for practitioners to use without any kind of mandate around how they should use it. It very quickly got to a point in our pilot area where practitioners were saying, actually, this screening process is really kind of starting to challenge our preconceptions, our professional judgment. And we think that the best way to approach this is to universally screen children. So that was a definite kind of practitioner-led recommendation. So now the way that we use Welcome, and there's the thing that we've kind of scaled up most across the city at the moment, is to universally screen. So that's every child every year, just to make sure that we're kind of not missing anyone. That's always carefully managed, so it doesn't supplant professional judgment. It's to further inform or challenge it. Super important that we get that balance right. We commission speech and language therapists who work specifically within early talk for York, so that's not early access to therapeutic intervention for children in the early talk for York areas. They have to go through the same process to get that support from the hospital. However, we commission speech and language therapists from our local teaching hospital. Again, it's an example of that kind of systems improvement I was talking about at the beginning, that's been a great opportunity to open up the dialogue between the kind of wider early years system and the specialists at the hospital. What those speech and language therapists do is provide additional advice, support and guidance for those professionals working in a kind of universal and targeted space. to ensure that they're doing everything that they can to support children's speech language development, and also kind of reassurance around appropriateness of referrals into the hospital also. The final couple of bits that I'd talk about in core activity kind of build on that communications community stuff that I talked about earlier. We've got a brilliant family learning team in York who have worked really closely with us to think about how we support the adults in the family to support their children, but also to develop their own skills and knowledge in an appropriate way also. So we've kind of got some bespoke family learning work going on in relation to Early Talk for York. And then we've partnered with the NSPCC to bring the Look, Say, Sing, Play campaign to York. If you haven't come across the Look, Say, Sing, Play campaign, it's kind of 0 to 2 focused on the high quality interactions between parent, carer and baby that we know are kind of fundamental foundations for good development. Thanks. Next slide, please. Just to briefly touch on these things, these are some of the things that we kind of didn't set out with a specific ambition around, but have been excellent positive consequences of the Early Talk for York development. So our health visiting colleagues who also use Welcome in some of their work are rolling out the use of ELIM at the 2 to 2.5 year review, which kind of meets with the principles of Early Talk for York. Off the back of better integrated working, for the first time ever, we've got an integrated review up and running at 2. We're very fortunate that we've got 2 excellent universities in York who are very civically minded, who have forged stronger partnerships with us, and we're using students in creative ways to support the work. And we've also, with the kind of rise of practitioners in York who have additional qualifications in speech language communication, developed a peer model of support, which we're calling our Speech Language Communication Hub, which just enhances capacity across the system, I guess. Thanks. Next slide, please. So just a little bit to kind of wrap up around evaluation. So this is the kind of key learning that I draw your attention to around Early Talk for York. This is what our evaluation so far tells us are we call them the active ingredients, the things that make Early Talk for York successful and that really matter. So looping right back around to the beginning, that first one on there, having a relentless focus on speech language communication as a top priority that impacts on whole of life outcomes. That's super important for supporting the ongoing success of Early Talk for York at every level and in every organisation across the system. And where that's so, it just makes the rest of it far more straightforward. The other ones, we've talked about high quality training already, ensuring that that's cascaded really well. The universal screening of children's needs, making sure we've got ongoing specialists who are there. The ongoing support specialists who are there to be able to kind of respond proactively. And then finally, there's value in the collective of the community of that kind of peer and social support. We're all in this together. We're all looking to improve it together. It makes a big difference, the kind of systems approach with Early Talk for York. Thanks. Next slide, please. So we've seen impact across a number of ways. So this is a typical report that we get from schools and settings involved in Early Talk for York. So this leader says our staff in EYFS are now more confident in identifying when children may have a speech and language need, which is allowing us to support the children with relevant interventions. Staff are more confident in knowing how to support these children and when they should refer them to a speech and language therapist. And I say that's kind of a fairly typical summary of what people tell us about being involved in the approach. Thanks. Next slide, please. We've seen an increase in identification across the piece, which was something we kind of set out in our theory of change to respond to. You can see the kind of headline of that there. This is the Welcome red, amber, green headlines. Obviously, lots more kind of detail and nuance underneath that. It's helped us to kind of expose further the disadvantage gap, particular age 2, for example. And for the first time ever, we were able to collect this data right the way across the city, January of this year. So that was 4,000 children's screening results back into us as a local authority, which we're able to use to kind of further target and scale our work also. Next slide, please. Lots of examples of kind of system-wide improvement. We had our local area send revisit in December of last year, Ofsted and CQC. This is what they had to say about it. So an effective example of joint commissioning impacting positively on the lives of children, young people and their families. And a bit of a comment about the impact, which I'll go on to in a second. We've had multiple inspections across various organisations involved during the life of Early Talk for York, and kind of consistent positive feedback around the way in which Early Talk for York is improving. Also, local government association review kind of also supporting that kind of view that this is a good piece of work that's having desired impact. Almost last one. So, and this final slide, if you just do one click for me, Paul, thanks. So we've always said right from the outset that the thing we want to see improve through Early Talk for York ultimately is children's outcomes in the speech language communication domains of the early years foundation stage profile. So that's by the time children are 5. Lots of stuff that's important before that, but that's where we're kind of always holding ourselves our yardstick and ourselves accountable for. So this graph shows that information. 2020 is missing. Pandemic caused a pause in reporting. 21 is an incomplete data set, but we think it's kind of good enough to be sharing for work like this. So first 2 clicks, please, Paul. So that's the national picture. You can see the disadvantage gap, the kind of the COVID dip, and the return in 2022 to outcomes for both disadvantaged children and non-disadvantaged children being below pre-pandemic levels. Next 2, please, Paul. That's the York picture again. We see that it's that kind of same profile that I highlighted at the beginning. Interesting kind of little bit just at 2022 there, just starting to rise above national for our disadvantaged cohort. Really looking forward to seeing what 2023 brings. Next 2, please, Paul. So in Early Talk for York, we used a quasi-experimental design to evaluation. So we used some control group schools to look at what the difference was between where we were doing Early Talk for York and business as usual. So these schools were matched on size of cohort, previous outcomes, and levels of disadvantage in them. Stop in 21 because some of those schools started to join Early Talk for York after that period, but you can see a kind of similar trend there. Just one more, Paul, please. So this is our Early Talk for York schools now. This is the non-disadvantaged cohort. So you'll see this is the only cohort on the graph where outcomes are stronger post-pandemic than they were pre-pandemic, and very, very close to the city average, which has never happened before for that group of schools. And last one, please, Paul. And finally, our disadvantaged cohort in Early Talk for York, the group we've been most concerned about. You'll notice the only line on the graph that doesn't have a pandemic dip, and from a gap between those disadvantaged children and the non-disadvantaged children nationally in 2018 of 35% to a gap of 2.5% in 2022. So gives us some confidence around the impact that Early Talk for York is having locally, and allows us to kind of plough on with our scale up also. Really kind of pleased with what we've seen so far. You know, watch this space in 2023, I think. Final slide from me. Thanks, Paul. Just to give a sense of you know, the work is never done here. We've broken the Early Talk for York approach down into 3 steps because there's a lot involved in it. So just trying to help people kind of do that in a more staged approach. Our scale up of Welcome is across the city. So we've got about 90% of our schools and settings using Welcome at the moment. And like I said, we're kind of using the data from that to further inform our targeting to get that 3rd bullet point, more schools and settings, to step 3. So that's the kind of complete Early Talk for York package. We know we've got more to do in the kind of 0 to 2 space, and particularly with parents and carers. Some of that's been hampered by the pandemic. We're also keen to invest further in evaluation and to commission a completely external, more robust evaluation of our work. And as I'm sure many of you are doing, we're kind of actively working on our family hubs development at the moment, and particularly some of that systems improvement stuff that we've seen in early talk for York. There's kind of direct relationship and feed into that agenda also. Paul, I hope I haven't taken too much time. That's the end of my presentation. Thanks so much for listening, everyone.
No, you haven't, Rob. That was absolutely superb. Thanks very much, Rob. Really great presentation, and just looking at all the fantastic outcomes at York is just incredible. Thank you very much for that. I'm sorry, at my introduction, I referred so many times to projects. We just keep talking about projects within our team and whatever, so my apologies for that right at the outset. Just one housekeeping thing. We've had a number of people saying that they can't put any questions into the chat area. Can we just advise everybody to put any of your questions into the Q&A area, and that's where we'll pick your questions up. So thank you for that.